Welcome to the To Health with That podcast, where we break up big health topics into small bites. I'm your host, naturopathic Dr. Amy Neuzil, and this season isn't actually a season because I'm busy working on a book. So, what we will have is a few episodes when there's something important to talk about related to MTHFR that hasn't come up in other seasons. I can't wait to get started this week. Let's talk a little bit more about how much L5 methyl tetrahydrofolate or methylfolate is too much for MTHFR. So as we discussed last episode, high levels of folic acid specifically come with some well-documented risks. And some of those risks might also apply to better forms of folate, including methylfolate, the active form. The research around safe upper limits for methylfolate hasn't actually been done yet. So we're left with educated guessing. Because this is an area without any solid footing, I can only tell you what I think is reasonable, but it should go without saying that you need to consider what sounds reasonable for you, given your personal health history, symptoms, and risk profile. And 3 aspects to consider when you're looking at your methylfolate dosing. First and foremost is symptom management. Are your symptoms being effectively managed by the dose you're taking? Second is risks from high folate doses in your particular situation. And third is your blood labs. This means you have to take enough to manage your symptoms effectively, because if it's not managing your symptoms, then why are you taking it, right? Then we're defeating the purpose. So if you're working with something like treatment-resistant depression and your mood is better with a whopping 15 milligram dose of methylfolate, but you notice an increase in depression if you take less than that, it's pretty clear that 15 milligrams, even though it's a high dose, is the effective dose for you. And unless there's some contraindicating risk, like say you're diagnosed with cancer that could grow in the presence of so much folate, then it's crucial for you therapeutically to stick to the dose that works. The most important risk situation, of course, that needs to be considered is actually tumors, cancer, right? So we do not want cancer to grow unnecessarily in the presence of high folate. Regarding blood testing, even if you're only exposed to active forms, it makes sense to me to try to keep serum folate levels between 8 micrograms per liter and 16 micrograms per liter. Please bear in mind, that's entirely arbitrary and particular to me. So North American standard testing doesn't have a range. It only has a lower limit. And if you're above that lower limit, then your folate is considered normal. Normal is 4 micrograms per liter. I try to stay between 8 micrograms per liter and 16 micrograms per liter for the arbitrary reason that double to quadruple the lower limit sounds like it might be approximating a safe upper limit for normal. Now, that's entirely guesswork, so stay skeptical, and I will update this as much as I can as more research comes to light. Because this is largely speculative, I will walk you through my usual methylfolate regime in the hopes that it'll help you find the right dosing for you. My diet is high in natural folates, hovering around the 400 microgram per day RDA in the US. And it's almost 100% free of folic acid fortified foods. There are exceptions, but they're few and far between, not regular. That provides a stable foundation on which I know that my body won't accumulate unmetabolized folic acid because there's no folic acid there, or block up folate receptors with the shiny, overly perfect synthetic folic acid crystal. I do take a reasonable dose of methylfolate on days when I need support for symptoms, especially energy level. That dose is usually between 1,400 and 3,400 micrograms, just depending on how much support I feel like I need that day. Days that I need support could happen once a week, could happen every couple of weeks, or could even happen 3 times a week. You just never know. So I can tolerate a reasonable dose when I take it, but I take it sporadically in the grand scheme of things. I do want to point out, I don't take any supplements daily, mostly because I just don't work like that. right? There's nothing I take daily. But I do rotate through a group of maybe 6 to 7 supplements that I take with this as needed type of arrangement. Some days I feel like I need more antioxidant support, and so I load up on the antioxidants. Some days, just basic vitamin support, and most days I take at least some form of magnesium or trace minerals. The days when I need extra energy boost, I'll add 1,000 microgram methylfolate dose in there. This works out for me in terms of symptom management and hopefully keeps me below the danger zone in terms of the risks of high dose folate. At the end of the day, it's really important to remember that every supplement, every nutrient, and every drug you take in is going to have effects on your body and your health. And we don't know what all of those are. So there will obviously be some very positive effects, but there will also be some negative effects. That is just how life works. There is nothing that is 100% good for you. So the safest course of action is always to use caution around medications and supplements and use them sparingly. And above all else, always, always, always listen to your body. Please remember that this is not intended to substitute for the guidance or care of a qualified physician who actually knows your personal medical history and can give you real medical guidance. This podcast is for information purposes only. Not just this episode, but every episode. I figured you knew that. See you next time.